Doug and I decided to change jobs today, so I'm going to talk about healthcare, and he's going to talk about the budget. Showing that we all are actually quite versed in a lot of these.
Right, and I'm going to correct Susan, and she's going to correct
That's
me. There we go. Go
See,
ahead.
we may not be kids anymore, but we're still quite flexible. I do want to talk about healthcare, but I want to start it is with the tone of the campaign. And I don't know about the rest of them, but I'm certainly hearing from family and friends as they watch this that they're really glad that I am not the candidate. Because any of us that would have been the candidate, it's obvious that the Republicans' approach to campaigning is to instill fear and to, even when corrected, to continue to say, this is the truth, this is the truth, this is the truth. Whether it's about Peter's ideas about corrections, and that are actually ideas that we've been working on in the legislature for a number of years, or if it's about a speeding ticket, to continue to distort and lie about what the truth is. And that's a real disappointment to me. And part of it's a disappointment because, Doug and Peter and I were, in the Senate with Brian for 8 years. And I don't know who this person is, but it's, this is not real Vermont. This is real outside Vermont, and this is real nasty, and this isn't okay. And what, as Deb said, we all managed to do in a pretty spirited primary was to share our vision. And they weren't just visions, and they weren't just abstract things and platitudes. They were real ideas about how we would address everything from creating jobs, to weatherization, to education, to healthcare. They were real steps that we would take to move Vermont forward. I don't know how many of you have bothered to actually read Brian's plan. If you have, you will find about half of it is things that we're already doing. A lot of it, if you went through and started to try and add it up, you could ask the question, so how's he planning on paying for it? But I kind of want to focus on healthcare, because a couple of the things that he says in healthcare were really kind of interesting to me. And at one of the last debates we had, the Democrats down in Bennington did a lot of research on all the things that Brian has said about healthcare, and all the things he had already said in the campaign about healthcare. And they were interested in how we as individual candidates would respond to Brian's approach to solving healthcare. And I really got into it. Woo! Obviously, healthcare, and people don't tend to associate the chair of appropriations with healthcare, but I so see what a driver it is in the budget. And you see at home, for those of us that are out there with all kinds of people all the time, what an issue healthcare is. And we have all seen, so here comes the former teacher, here's my visual aid, and we've all seen these cans all over the state, and you get asked to buy lottery tickets, or here's a benefit dinner, to help some Vermont family pay the healthcare bills, or to help pay the healthcare bills for someone in their family who has dared to do something terrible like get cancer and not have the right coverage. Who has had an accident, fallen off the roof while they were cleaning the chimney, and now has hundreds of thousands of dollars of health care bill and no coverage. Brian has said again and again, and what a lot of Republicans are saying is that, well, we just need to let the federal government take care of it. And they're trying to instill fear about health care reform in this state. One of the issues for Vermont is that we've been a real leader in healthcare for years. And because of that, a lot of the healthcare that's passed in Washington really isn't a lot of benefit to Vermont because we're way ahead of a lot of people. And as an appropriations person, and I've heard people say, well, we're too far ahead, we have to wait, we have to wait. And we kind of keep going, the federal government will keep up with us. Well, they didn't keep up with us on pharmaceuticals, and it costs Vermont millions of dollars to make sure that Vermonters do have access to pharmaceuticals so that they can be healthy, so that they don't have to choose between food and heat and their pharmaceuticals. Right now, the big scare that Brian's trying to put into, and the Republicans are trying to, is that it's single payer and it's a giant government run that's going to cost billions and billions of dollars. That's not based on anything. It's not based on anything. We have a report coming back in that's going to tell us how to get to where we need to go with health care so that everybody has the health care that they need, when they need it, where they need it, and at a cost they can afford. But also that it's a system that is sustainable. We're not certain what that's going to look like, but I am sure that Vermont will continue, if given the opportunity with the right governor, to lead the country in comprehensive health care reform. In 2009, 50% of the households in the state of Vermont at some point during the year were called by collection agencies over their health care bills. Don't tell me, Brian Doobie and Republicans, that the system we have is okay and that we just need to nibble around the edges to make it better. This is not how we need to have people pay for their health care. It's not okay. We need to move forward so that we really do have comprehensive health care reform. And somebody like Peter is going to be the kind of governor that will get us there.